everybody, it's Dr. Tracy Papa. Last week, if you remember, we met Melissa and her son Aiden, who has a condition called gastroschisis. We got up to the point where Aiden was born, and that's where things started to get even more interesting. In the majority of cases of gastroschisis, the abdominal opening stays open so that the intestines can be placed back into the abdomen. In Aiden's case, that abdominal opening closed prior to delivery, and instead of being able to put all that bowel back inside, the blood supply was cut off, and he lost about 3/4 of his intestine, resulting in another condition called short gut syndrome or short bowel syndrome. So listen to the last of Melissa's story, and you'll find out about the last 7 years of Aiden's life, the series of surgeries that he's been through, the medical conditions that he still has to contend with, and the hope that's on the horizon with new treatments and new medications that are going to help him hopefully live a long and healthy life.
My OB came to check up on me that evening and said, for you to get discharged, you need to be up and moving. So 5 o'clock the next morning, I was walking laps. I was eating. I said, okay, I need to go. My baby's about to have surgery. I need to get out of here. So he was born at 6 p.m. and I think by like 8 o'clock in the morning, I was discharged because I was ready to go meet my baby. I remember checking in with the NICU, and by the way, that is a long walk after you get discharged, going from the front doors at Cook's all the way up to the NICU. So I remember checking in, going to see Aiden, and he was perfect. He already had an art line in. He wasn't on oxygen. He looked great. He looked perfectly healthy. There was no defects. So I was like, oh, it's just crazy that he's this sick. Next thing I knew, this anesthesiologist came in. I gave consent. The surgeon's nurse came in, talked about blood products. If I consent, obviously I did. Surgeon came in. We didn't know what we were getting into. He said it's an exploratory surgery. He's going to make an incision. We're going to go in. We don't know what we expect to see. We don't know. They hadn't seen this at Cook's before. They had never had a documented vanishing gastroschisis case at Cook's. So we didn't know what we were getting into. So I think his surgery started about 12 o'clock. I think it lasted about 3 hours. And again, we had no idea how bad it was. We were thinking simple fix, everything's going to be great. That was the best case scenario. And then the surgeon came out, and he sat down with us. His name was Dr. Uffman. And he sat down and said that Aiden lost majority of his bowel. He only had 10% of his intestine left. That's including large and small intestine total. He explained to us that he will probably be on TPN and have a feeding tube for the rest of his life. That was a lot to take in. I just remember feeling so helpless. Just, here's this small child that I'm supposed to protect, and, I see people having these, wonderful white picket fence families, and everything's going perfect, and that wasn't our case. I was going to have this medically complex child for the rest of his life. At the time, though, I think I was very naive to it, and I didn't want to accept the reality. I remember it was the first time I ever got to hold him after birth, and he was 4 days old. And I remember holding him, and I kept thinking, oh, his color looks so good. He looks so good. He has such pretty complexion. Not realizing he was jaundice. He was orange. Looking back at pictures, he was orange. It looked like a spray tan gone bad. It was so bad. And I remember a doctor coming in to tell me, Aiden is really sick and his liver is failing. And she said, he is going to need a transplant. And if it continues like it is, he's going to need one before he turns 6 months old. And I remember asking her, I knew the answer, but I remember asking her what happens if he doesn't get a transplant. And she just looked at me and she said, you know what that means. She didn't want to say it. I didn't want to hear it. I didn't even want to think about it. But I knew, I was going to outlive my child if something didn't change drastically. Shortly after that, we were referred to Pittsburgh Children's for transplant evaluation. It was explained to me again that basically Aiden would need a transplant to live. He would not be able to live long term on TPN and lipids. that death was inevitable if we didn't do something. So we hopped on a plane when Aiden was 5 months old to Pittsburgh and stayed there for a week. We were actually supposed to go home. We were supposed to come home on a Friday, go home on that Monday with home health and get set up. And while we were there, he was not listed at that point for transplant. But they determined, basically they'll continue to follow him every 6 months to ensure that he was meeting his requirements for nutrition, meeting his milestones, that sort of thing. And if we needed to, then we could later on list him for a transplant. So he was up there for a week. He ended up getting a line infection that was almost fatal. I remember in the hospital, he was still in NICU in the Pittsburgh, and so his heart rate was up 10 beats more per minute than what it normally was. And I kept saying, that's not right. And they said, oh no, it's fine. I said, no, that's higher than what it normally is. It's normally this. They said, oh, well, it can vary, it can change a little bit. I said, that's just not as normal. I really just feel like something's wrong. Sure enough, the next day we were supposed to get on an airplane. He spiked a fever 106 and was very, very sick. They almost didn't transport us. I was like, no, you're getting us back down to Texas now. Like, we have got to go. So we came back. They drew cultures immediately upon arrival. We started antibiotics. And then come to find out it was a fungal infection with yeast. And so his line had to be pulled. Every time we pull a line, that's a risk for loss of access, which increases his transfer to transplantation, which we don't want. We were in the hospital for another 3 weeks. So we went home June 5th of 2012, and he was born January 12th. So it was a long time in the NICU. The NICU became our family. I mean, they were there for the tough times. They were good for the good times. They were my family for the longest time. Most of his NICU experience I went through alone. His dad and I separated when Aiden was 2 weeks old. So most of this I was by myself, which I think made it even more difficult. We got home and I remember sitting down thinking, what do I do? Like, I have this medically complex child. He went home on TPN, lipids. He has a permanent IV in his chest. He had a feeding tube. He had 8 different medications that he had to get around the clock. He was connected to his IV 21 hours out of the day. He was connected to feeds 24 hours out of the day. And I was completely overwhelmed. So I didn't know what to do. So our morning starts about 6 to 7 a.m. I wake up, I make his feeds. I give him his morning feeds, I give him his morning meds. I disconnect him from his TPN. So he actually goes to school full time. Up until this year, he had a private duty nurse, and then Aiden said, I don't want a nurse anymore. I'm tired of someone looking over my shoulder all the time and telling on me, because he's in first grade and he's very independent. I was personally tired of having a nurse in my home all the time. I'm a nurse. I got tired of it. So we did away with nursing. My mom is actually his attendant, and so she helps basically keep me sane, keep me organized, and make sure I have a head on my shoulders, because if it wasn't for her, I would probably have lost my sanity a long time ago. So he goes to school, and then he comes home. We do his, he normally eats a stack as soon as he comes home because he's very hungry. He's not getting the nutrition he needs, so he eats a pretty big meal when he gets home. We get ready for the evening. We make his IV nutrition. We add the additives that's needed. We prime and prep the tubing. We connect the tubing to him, and it ran for 12 hours, and that's his schedule. So, and then we do the nighttime feeds. We do nighttime meds, and that's a day. It sounds easy on paper, but then you have, the cap changes we have to do twice a week. We do dressing changes at least once a week, which those are sterile procedures. We were following it with Pittsburgh every 6 months, and then we kind of backed off there. He was actually listed for a transplant when he was 2 years old as a precautionary. It was kind of weird how that happened, because we listed him as a precautionary as a status 2, which means his health was stable, but it could become critical, and so we would potentially need a transplant. So we're actively seeking, but it wasn't as critical. Status 1 is you're actively seeking and you need an intestinal transplant, like now. So that was when he was 2, and then we listed him as a precautionary in case, and exactly what I said is, in case he gets some kind of virus that wipes him out, we have this as a backup. We got back from Pittsburgh, and 2 weeks later we were in the hospital for a month and a half, and with an unknown virus that completely wiped him out. We were down to 12 hours of TPN before this virus hit. And then when we came home, we were completely TP independent for 21 hours out of the day. He was not tolerating feeds. We did several biopsies, and his villi and his intestine were completely gone. Basically, he had no means to absorb nutrition. And it took about 3 years to regain where we were. At that time, we were very thankful that he was listed for a transplant, because the reality of him needing needing a transplant was real at that point. So we followed up with Pittsburgh every 6 months. And that means we get on a plane with IVs and tubings and all his IV medications, and we go through security, which is always a good time. A couple weeks ago, was a year ago, that we were in Pittsburgh, and I asked them, can we get transferred to Boston? Can you give us a referral to Boston? And they said, well, we don't refer to bigger institutions, basically. And I said, well, this is what I think is best for Aiden. They're number one in the country for a reason. They have, while y'all see several transplant-related cases, they see more bowel rehabilitation cases. They are the experts in short bowel syndrome, especially gastroschisis and short bowel syndrome, which is an entirely different specialty, basically. I don't know how we did it. It was by the grace of God. It must have been because I took a job with Weatherford ISD, and I'm paying insurance through them because since he is disabled, he has Medicaid. Medicaid would not approve it because they are not in contract with them. So I was paying ungodly amount of insurance, as anyone is, but to basically get us approval to go to Boston. In October, we first went up there, and they said, yes, we would love to take him, but this is what it means. You will be up here every 8 weeks. This is a requirement. We know it's a lot. If you don't feel comfortable doing it, then that's okay. And I said, it's not what I'm comfortable with. It's about saving my child's life at this point. When he first went up there, he was 39 pounds, and he's now 47 pounds. He's grown 3.5 inches, which is the most he's ever gained or grown. His liver numbers have actually decreased by half, so he still has what's considered a fatty liver, but he has, his labs reflect those of a healthy person. The chances of him getting off TPN are still very slim to none. He will probably, the way it was explained to me, he will probably always be on IV nutrition, but thankfully there was just a drug that was approved 2 days ago for pediatric use that was approved for adult use about, I think, 2 years ago, called Gattex, and so we're hoping that we're a candidate for that. Boston's already recommended that we could potentially use that, and so hopefully that will reduce our time on TPN. I feel like we're going in the right direction. I feel like Aiden, he's doing great health-wise. He is growing, he's thriving, he has so many friends at school. He has a neighbor, best friend that he plays with. He has a great relationship with his family. And that's the best thing for him. I hope that continues. I know the reality of the absolute worst case scenario is possible. I know that tomorrow that reality, or that thought or that possibility could become reality. But I'm very thankful for the days that I do have. It's a hard pill to swallow to realize that you will probably outlive your child. But it makes me that much more thankful and grateful for the time that I do have. It makes me that much more appreciative for the arguments we have, because he is a 7-year-old and him and I will go at it. It puts everything into perspective of what really matters. The little things about him not picking up his clothes, it's not that big of a deal. We'll live with it, we'll do it later. And then during the hard times, it makes you wish you were arguing over picking up your clothes in the bedroom. I'm very grateful for this journey that I've been on with him. I hate that he's been through so much, and I hate that he's the one that's having to go through all these medical procedures and in this pain and the anxiety and the stress. I hate that for him, but I'm very grateful that I get to be the one that's going through it with him. I wouldn't trade our relationship for the world. Him and I tell him all the time, he's my best friend. He's 7, but he is my best friend. We've been through more than most people have, especially at, I was 19 and now I'm 26. and he's 7. And you know, him and I have been through more than most people have gone through, and I'm so grateful for the opportunity to be his mom. And I'm very grateful for the wonderful physicians that we've met along the way and that we continue to meet, and the relationships that we continue to form with people. I've met some great friends through this journey. Aiden's met some people, you know, very similar to him that have gone through similar things. And so it has extended our family, and I'm very grateful for that.